All right, folks, it's time to start thinking about this test and how you're going to study. There's a lot of ways that you can study. You could go through all your stuff. You could make notes. One of the things that I've seen people do is have different columns of everything that we've talked about. So you could have pancreatitis and talk about the patho, the meds, your treatment, blah, blah, blah. Some people use that. Some people just read and keep studying and trying to absorb that information. You might be newer to studying for nursing and you're going to find your way. I think my first year in nursing school, I had a totally different way than my senior year of how to study. So keep finding what's best for you. The big key is study, study, study. One of the big things I want you to look into is medications, right? So if you're going to make yourself a chart, have a specific, okay, I have pancreatitis, what meds am I going to give? They have ulcerative colitis, what meds am I going to give? And things like that. The other advice I have for your test is know your normal vital signs, okay? What are your normal vital signs and what are you going to find or what are you going to do if a vital sign is outside that normal limit? Okay, low blood pressure, high temperature, right? So you want to know your normal. So when you're looking at the test and it says, hey, this patient thing, you're worried about this, what worries you the most? And you have like the list of stuff and, you want to know what's your normal blood pressure and things like that so you can go outside of that. And including sepsis. One of the first signs of sepsis, temperature, respiratory rate. Last sign of sepsis, blood pressure, right? So things to think about with vital signs. So know your sign and symptoms of disease, know your interventions of what you're going to do as a nurse. And a big piece of nursing is teaching. So this patient comes in with this and they tell you A, B, C, and D. What are you going to correct out of that, right? So really a big one, because this is GI, right? Look at diet teaching. Okay, this patient comes in with blank, and they say, I'm going to eat this. What kind of education are you going to give? Okay. No complications and lab results. And I know that's a lot of stuff, but if a chart helps you, great. Just look at those key pieces, signs and symptoms, interventions, teaching, complications, and labs are good. So however you figure out that to really take this test. Again, teaching. Think teaching. So when you're looking at interventions, think, if my patient came up with a question, would I be able to teach this? Okay. When it comes to tests like EGDs, colonoscopies, just kind of look over how to prep that patient as a nurse. And then overall, I want to talk to you about how to take a nursing test. This is kind of a hard concept to grasp around. So I might talk a lot about this in your study guides in the future for tests. But when you're looking at the answers, all 4 answers could be correct. And I want to add on that we had some select all that applied. These are not select all that apply. They're straight answers. Okay. So 1 answer per question, which is nice. But when you're looking at the answers, think of priority. Okay. So if all 4 of these are correct, what is my priority? Do I need to assess something before I do an action? Right? Think about this even as you're in clinicals, right? You walk in and this is going on. Before you run and go tell the doctor, what are you going to assess first? Okay. Also think airway, breathing, circulation. Okay. Those assesses come first and you're going to intervene, right? So if I walk into the room, I'm going to look at airway and appearance. Okay. Are they breathing? Is everything normal? How's their oxygen with that breathing and circulation and bleed? Are they bleeding somewhere? And then, let's say you see a patient and, their oxygen levels are low. What's your first thing you're going to do? And if your question says you're going to assess their lung sounds, no, I'm going to put some oxygen on that patient because they need to breathe, right? So just think about those things. ABC, airway, breathing, circulation, always takes priority over other things. So really, when you're thinking about those questions, think, what is the priority in this? And what am I going to assess before I perform an action? The only time the actions really trump is when it really compromises the ABCs or there's no other options. Okay, so practice some nursing test questions. You can find some online. You can find some in your books. I think when it came to the NCLEX for me, taking questions and learning how to take nursing questions is a big part of nursing, okay? This is your first test in this course, and the tests are huge parts. Just a reminder, you have to pass the theory the portion. That grade counts first, then your clinical addition to it, right? So if you get all 100% in your clinicals and you still fail the theory part, it's not the average of the two. It is your theory grade that really matters. Okay, so the tests are a huge part of this. This first test is going to be a big test of how you take tests. If you do not do great, you have learned on how to improve for the next time, okay? There are plenty of resources I can send you if you need for tutors. But take your time. This is big. Study. And when you take the test, take a big breath. It's going to be okay. Try to take out any kind of distractions. If you are working, don't do it immediately after a 12-hour night shift or even a 12-hour day shift, which sounds worse to me than a 12-hour night shift. But really take your time, breathe. You have 2 hours. You can't go back into a test question. So if you're like, man, I don't know the answer to that, I'm going to come back later. You have to pick. And that's almost better because that's how the NCLEX works, right? There's no going back. There's only going forward. Again, I talk about it in week 3, but make sure, please, to look to schedule appropriately. Do not wait till Saturday to take your test, please. It gives you clear instruction on how to use the Lockout browser. If you have kids, don't have them near you. I know I probably could get my daughter to be distracted for maybe a couple hours, but if she walks in, then the test is going to shut down and going to have to be reopened. Okay, so give yourself time. And take a deep breath. You got this. You can do this. And we'll keep chunking away until the next week. Okay. So reach out if you have any questions. I try to give you a lot in this little, I can't give you answers, but again, think of how to take the test. Think of meds, and think of treatments and what you're going to do as a nurse, and education, how you're going to teach the patient. So those are the big pieces to look at. Good luck. I hope you do so well. I'm praying for you, and let me know if you have any questions. Thank you, guys.